I'd like to explore how you feel this is going. Let's revisit what you want to achieve in these sessions and any progress.
Hey, good morning.
Good morning. What's this?
Happy birthday. The flat white decaf with oat milk, right?
Yes, thank you. What prompted this?
It's your birthday tomorrow, right?
Yes, I don't recall that coming up in section.
It didn't. I'm observant, as you probably noticed. Just wanted to show my appreciation. You're often the best part of my week. Don't be offended.
Oh, no, I'm not.
Your hair looks nice.
I'm not offended. It's thoughtful but unnecessary. Thank you. There's a kitchen here.
Oh, I was getting a coffee anyway, and I just wanted to do that for you. Nice sweater.
Do you mind if I save it for later? I'm having tea.
Oh, no problem. Are you sick?
Take a look through. Nothing to worry about.
Oh, wish I had known.
I appreciate your concern, but I'm fine. Let's talk about you. How are things going this week?
No problem. Something about you just makes me want to do nice things for you.
Let's explore that. What about your patient experience prompts you to want to do nice things for me?
I don't know. I suppose I just have a soft spot for vulnerable females.
Mhm. And why is that? What makes you see a vulnerable female in this context instead of your therapist who kind of likes to be seen?
It's just how I was raised, I guess. I was taught that's how a gentleman ought to behave toward female.
That's an interesting choice of words. I'm curious why you would bring that approach to our sessions, where my role is to help you change your behavioral, to make lasting behavioral changes that brings you closer to your goals. You understand that it is unusual for a patient to care about the well-being of their therapist.
Sorry. That wasn't my intention at all. I was just trying to be thoughtful.
It is thoughtful, and I understand why you might see it that way, but you understand that's not a typical dynamic between a patient and a therapist in terms of you came to me with certain goals. Did you agree?
Yeah, sure.
So let's revisit those goals. During your intake last fall, you mentioned certain challenges with women in your life.
Yeah, I sure did. I mean, I still do.
So over the past 6 months, have you seen improvement in those relationships?
I guess that depends on how you define progress.
In this context, I would define progress as incorporating listening tools, body language cues, tone of voice, the framing of questions, and how you communicate, and not just with women, but with everybody.
Yeah. A little. I mean, it's not like I talk to a lot of beautiful, intelligent women in my line of work. In fact, you are hands down the smartest and prettiest lady I know. So, yeah, not a lot of chances to practice that kind of sweet talking with a lady.
Let's explore that. So when I hear you objectifying comments, or when I hear you make objectifying comments, it tells me that you're speaking instinctually rather than from your intellect, without enough thought about how your words are landing.
How do you mean?
Well, correct me if I'm misinterpreting, but I hear that women in your life aren't attractive or intelligent enough to merit a thoughtful conversation.
Is that what I said?
It's implied by your framing and the words you chose to express yourself. I mean, whether or not someone's pretty or smart or any person you're speaking with could be a thoughtful person. Would you give the same respect and courtesy to a grocery clerk or the houseless lady who lives outside the Starbucks?
I don't know, are they hot?
Is that important to you?
I'm kidding. I was just kidding.
Are you?
Of course.
Would you
Would I, what?
show the same respect to the houseless woman or the grocery clerk?
If I'm being completely honest, probably not. I mean, I say hello sometimes. I tip, usually. But I put a fiver in the bag lady's cup, you know, around Christmas time. I'm not an animal.
Well, to be more direct, what I'm asking is whether you would be better served by a different therapist, a male therapist even. What do you think?
Wait, is this because I saw you at that restaurant the other night?
That's not really relevant.
So what are you saying?
That I think you could make more gains with a therapist with whom you don't take a personal interest in outside the clinical setting.
So you're firing me? Because of what, a flat white decaf with oat milk?
I'm not making myself clear. It's my considered opinion that you would benefit from a different provider. I'm also leaving the clinic at the end of the month.
I'll transfer.
As a clinician, my goal is to provide you with the tools to make meaningful and lasting change in ways that you improve all of your relationships, not just with the women in your life.
So you are firing me.
That's not a helpful term. Let's pause a moment. Put your hands on your knees. Close your eyes. Take a long, deep breath in through your nose. Through your mouth. In, deep breath in. Out. In. And out. Now, remember our discussion about framing? I want you to try and put yourself in my shoes. As a clinician, we have worked together for 6 months. And I'm asking whether you might make progress with a practitioner you haven't developed personal interest in.
I don't want to start over with somebody else. I've spilled my guts out to you week after week, and look, I'm sorry. I'll be better. Just tell me what to do.
You've done nothing wrong. But what I have to offer you, it doesn't seem to be what will help you make the progress that you seek.
Wow. I thought we had a relationship, but I guess not.
We do have a relationship as patient and therapist.
So what's the problem?
Therapy is a journey, it's not a destination. There are times in our sessions where I have sensed a desire to wander from the therapeutic aspects, and perhaps that would be a factor with someone better keyed to you.
This is because I saw you at that restaurant.
That has nothing to do with it. But I confess it did make for an awkward moment.
Was that your husband?
Here's the thing about patient confidentiality. It has to work both ways. I can't pierce that veil for all kinds of reasons.
You look like you've seen a ghost.
My professional obligation is to respect your privacy outside of the consultation. I can't recognize you in public. It would violate the oath.
I'll wave it up. I don't care who knows.
I see that. However, it is my professional obligation to avoid that kind of interaction with a patient if I see them in court.
Okay then. It'll be our little secret.
I have taken the liberty of making a list of therapists I think might be a good fit for you. Dr. Matthews and Vishnatha are skilled clinicians, and Dr. Collins has a waiting list, but is willing to see you as well.
That's it. The last time I'll ever see you. Feels like punishment.
Changing therapists can feel challenging, but it's important to embrace change when it's for the better.
I don't want to change.
Okay, I know. I understand, and I'm flattered. But with insurance, the way it is, it won't be possible to continue.
And
No what?
forget it. It's nothing.
You sensing disappointment and some anger. Tell me about it.
I laid myself bare here and now you're abandoning me. Well, because I saw you in public.
Let me characterize it in a different way. At the gym, if you want to go stronger, you need to build up resistance. You think of me as the 10-pound barbell that you've just outgrown.
So. Here's the thing. I like my little 10 pounds.
You're comfortable with your metaphorical weights, but comfort doesn't make you stronger. This is the right thing for your continued care.
We'll keep in touch at least.
That will be appropriate.
But not even a Christmas card? I mean, come on. You're really punishing me. Hey, is this because I saw you at the movies that one time?
I'm not.
Yeah, well, clear enough. You don't like me and you don't want to bump into me anyway.
That's not it at all. There have to be healthy boundaries. This is a natural progression.
Yeah, you're saying the professional thing, but what you mean is get lost.
I feel you're making this more personal than it is.
Never been dismissed by a doctor before.
We have explored your attempts to find a level of emotional intimacy in sessions that may feel missing from your relationships. I think it's important to distinguish between the emotional honesty we experience in sessions with the emotional intimacy that you want in a relationship. I want to encourage you to be an active listener, not just here in your relationships with women, but with everyone. I'm here to help you transition to another provider, but it's important to respect the professional boundaries.
Yeah. You said so. So I'll have to take your word for it. I feel like my heart's been staked to a rock.
You know, I only want the best outcome for you. I have every confidence in your ability to navigate this.
Thanks for everything. I at least get like a hug or
Take care of yourself.
guess I'll have to. Just kidding. See you around, Doc. Just one more thing.
What's that?
Just how many times did you rehearse this conversation?
Yeah, it's over. Need a drink.